There are lots of ways to connect with us at KSJE. Like us on Facebook, follow us on Twitter, bookmark our website, ksje.com. This is KSJE, Farmington, New Mexico.
Sure, the 90-Second Naturalist is all about animals and plants, but it's also about us humans. After all, what creature is more amazing? We're the most creative and destructive, intelligent and foolish, loving and hateful beings on Earth. And we've come to have a significant effect, good or bad, on everything we touch. I'm Thane Maynard. Tune into the 90-Second Naturalist and find out how we're interacting with the natural world today.
Listen every weekday afternoon during the KSJE Evening News at 5:30.
Hi, I'm Yael Cassander.
And I'm Don Glass.
And we host A Moment of Science.
For more than 20 years, A Moment of Science has been taking an entertaining look at the science behind some of life's most perplexing questions.
In just 2 minutes, you get a look at the fascinating world around us and beyond.
We hope you'll tune in.
For more information about A Moment of Science or to download our latest podcasts, visit us at amomentofscience.org.
Listen weekday afternoons at 5:45 on KSJE. KSJE is a listener-supported radio station licensed to San Juan College in Farmington, New Mexico. We're thrilled to be able to offer new, innovative, and unique programming. But we need your help. See all the ways you can support KSJE by going to our website at ksje.com/support. This is 90.9 FM, KSJE, Farmington, New Mexico. This program is supported by San Juan Health Partners Urology, providing a wide range of personalized services for the whole family, including children. Our caring professionals are dedicated to helping meet your urology health needs with skill, experience, and service you need. For a complete listing of our services and to learn more, visit sanjuanhealthpartners.com or call 505-609-6300. San Juan Health Partners Urology, a division of San Juan Regional Medical Center. 15 minutes past 8 o'clock. It is Wednesday morning, the 19th day of September. Good morning, everyone. I'm Scott Michlin, and thank you for tuning in to KSJE 90.9 FM. Also, a big welcome to our viewers who are watching us live this morning from our visual radio studio here at San Juan College. We are streaming live this morning on the KSJE Facebook page and the brand new KSJE YouTube channel. So if you have not yet subscribed, we invite you to do that. If you have not yet liked us on Facebook, we hope you'll do that too, because this is where a lot of these video programs are streaming live, and they'll be archived as well. So if you're listening on the radio as you drive into work or school this morning, you can always watch these programs later on. You can also watch them on your smart TV if you have a YouTube channel, so that's another option for you as well. Coming up in just a moment, my guest this morning talking about modern medical care here in the community with San Juan Regional's Chief Medical Officer, Dr. Bob Underwood. He'll be joining me in just a few moments here on KSJE. We also want to remind you later on this hour, we'll be going live to the Encouragement Lab, which is where Dr. Mike Hadabaugh is standing by to talk with us. His weekly dose of communications advice, that's coming up later on this hour, about 8:55. Today on Roving with the Arts, Mick Hess is going to be playing Mahler's Symphony No. 2. You'll be hearing about that later on this morning at 9 on KSJE. And then, of course, today is Wednesday. That means Right on Four Corners. And Tracy Hales-Vass is going to be talking with author Elizabeth Crook. That is coming up today at 10:30 on KSJE as well. Also want to remind you about our regional events calendar at ksje.com. It's where you can check out some of the things that are going on in the community. We will take a look at that right now at our regional events calendar, and as you can see, there it is right there. Auditions for the 5th annual San Juan County's Got Talent program are happening throughout the month of September as things get ready for that event, which will be happening in October. That is with the San Juan County Partnership. Going on right now, a Focus on Farmington coffee event at the Bridge Assisted Living. That's a free event. If you need a cup of coffee this morning, can stop by and check it out. Also, relief from joint pain. San Juan Regional Medical Center for Workforce Excellence is coming up. That is happening later on today as well. We did a program about that just last week. You can look for the video or the podcast and learn more about the joint program at San Juan Regional Medical Center on our website, KSJE.com. So we hope you will check that out as well. Scrolling along on our regional events calendar, again, Integrated Software Workshop on the 20th, the Global Turkey event happening on the 21st at the National Hispanic Cultural Center in Albuquerque, and an event I definitely want to mention, which is happening right here at San Juan College. It is the return of the All Nations Community Powwow here at San Juan College, and that is happening at the ball fields on the north side of campus. That event has been held off campus for the last several years, but it is coming back. Also, September 21st, the Prime Rib Dinner to benefit Habitat for Humanity happening out at Sunray Park and Casino. As you can see, lots of things that are on our regional events calendar at ksje.com. You can check it out, get more details on all of those events that I mentioned and many, many more. Just go to our website, of course, at ksje.com. And if you have an event that a nonprofit organization that you're involved with is working on, we hope that you will add it to our regional events calendar as well. You can do that quite easily. Again, it's our website, ksje.com. Check it out, and we hope you will use it for all the things that you're involved with. Now let's go to my guest this morning here on KSJE. Radio studio, Dr. Bob Underwood is here. He is the Chief Medical Officer at San Juan Regional Medical Center. Dr. Underwood, good morning.
Good morning.
Thank you for being here.
Thanks.
Appreciate you coming in to talk a little bit more about the job that you do. We were talking before we came on the air this morning. It's been almost a year.
Almost, yes.
Right? Yep. December of last year.
December of last year is when I started. That's correct.
And talk to me a little bit about what you do. What is the job of the Chief Medical Officer, different from Chief of Staff?
That's correct. So I'm the Chief Medical Officer of the hospital, which means I'm one of the senior leadership team of the hospital. I do not practice medicine at the hospital. I'm more of an administrative role, overseeing the medical care that's provided at San Juan Regional Medical Center.
I see. And so you are juggling, watching all the different other medical professionals who were at the hospital, right?
That's correct, all of the above.
And how big a number is that for folks who aren't familiar? What are we talking about?
So actively, we have probably 175 or so medical staff members. We have quite a few number more physicians in our community, but those are the people that are actively working at the hospital on any given day.
Gotcha. They have the privileges, or is that the term?
Correct. They have privileges to practice at the hospital, and they actively see patients at the hospital. We have a number of people who are in the community who are a community affiliate, so they have credentials at the hospital, but they don't actively see patients. And then we have some that actually have active privileges, but don't admit very often.
I see.
So when I say 175, that's kind of people who are coming in, admitting patients, and are regularly part of the healthcare at the hospital. And that's everything you can think of: emergency physicians, radiologists, hospitalists, anesthesiologists, and a number of different surgical specialties.
Gotcha. That's a lot to keep track of, it sounds to me.
It is a lot to keep track of, that's true.
Yeah. And so you've been here about a year. You came to us from Colorado.
Pueblo, Colorado, where I was the Chief Medical Officer in the Centura system.
Gotcha. Yeah. Well, and you're enjoying it so far, you were telling me.
Love it.
Good.
Yep. I love it here in San Juan County and in the Farmington area. It's been very welcoming. The people have been incredibly great.
That's great.
To work with. So.
Good to hear. Well, yeah. I'm glad that you're with us this morning, because there's a lot, I think, about the medical care these days that confuses a lot of people, me included. And maybe you included, I don't know.
Me included, yes.
But there's a lot, and it seems to be kind of a moving target, a changing environment when we talk about maybe legislation, Affordable Care Act, insurance,
correct,
co-pays, and all.
Yep, absolutely. And I have to say that since I've been in healthcare, people have said I've never seen it change at a pace this fast. And I've been doing this for more than 20 years now, and it just seems to be speeding up.
Right. Good thing, bad thing?
Both.
Okay.
And it kind of depends on your perspective.
Gotcha.
Of course, change is difficult for people, especially people who have been doing the same thing for a long time. However, change is good because we always want to progress. And to be honest with you, healthcare wasn't always required to be as frugal as they've had to be in the more recent years. They've not had to watch money, and that's one of the reasons why healthcare costs in the U.S. have escalated. And that's, you know, down to the individual, but if you look at the national statistics, the cost of healthcare in the United States is going up faster than our gross domestic product, and that's unsustainable.
Right.
And so when we talk about regulations, as you brought up in the Affordable Care Act, a lot of that is driven towards how do we slow down the pace of that growth so that we can get it into a controllable level. It's quite an undertaking because it's so new, and that gets to how we have to change the way we manage healthcare. It has to do with how we finance healthcare. It has to do with the advancement of technology. Like you said, 100 moving parts or more to try to keep track of.
Right. And it seems to me like when we're talking about the patient, the insurance company, and the hospital and the doctors, and some groups are caught in the middle.
That's correct.
It seems a little bit about that tug of war, if you can describe it that way.
I think that you can. If you look at it in terms of healthcare management or graduate level education, they call it cost shifting. So one person ends up with the burden of the cost until they shift it to somebody else, and it kind of moves its way around from the payer to the provider to the patient. And somewhere in between, sometimes we're caught as to who's paying the burden of that.
Right.
So.
And at San Juan Regional Medical Center, it's somewhat unique in that it's a not-for-profit hospital, and there are other communities that have more for-profit medical facilities, and so that's a unique thing too, is it not?
I wouldn't say it's completely unique. A lot of healthcare organizations are religious or not-for-profit based.
Sure.
And then there are a number out there, and I think that number is actually growing in terms of for-profit organizations. What is unique about San Juan Regional Medical Center, and one of the things that attracted me here, is that A, it's not-for-profit, B, we are a standalone community facility. In other words, we're not part of a larger system. We are a community hospital that serves just this region. The other is that we are actually owned by the public, which I think leaves us very, very tied in a good way to our community. And those are all things that attracted me to this organization. The other is because we are a standalone facility tied to this community, is we set our direction. It's not a corporate entity that decides what San Juan Regional Medical Center is going to be doing. Rather, it is us determining that and trying to figure out what is best within our capabilities to serve our community.
Right, and it's the makeup of that corporate board of directors too that's very unique. I think very interesting, at least to me. I mean, it's a large number of people that come right from the community.
That's correct, and we meet quarterly, and I usually am one of the folks that will address the community in terms of what is our staffing of physicians who are recruiting into our area, in terms of what specialties, et cetera. So,
right.
Yeah.
And when we talk about healthcare these days, it seems like maybe folks remember their parents or grandparents talking about just going to the doctor, you know, make me feel better, I don't feel well, just, you know, give me a pill or whatever it takes and
right.
Send me home or admit me and whatever. These days it seems like doctors expect maybe patients to take a little more responsibility for their own health. We're trying more preventative care, at least trying to get patients to be a little bit more involved in their own health and that of their family. Is that?
Absolutely. I think that if we look at healthcare as a whole, there's always a lot of comparison to other countries,
right.
But that is something that is actually a little bit more well defined in other countries, is that personally responsible for your own health care. So we talk a lot about wellness, we talk a lot about preventative care, we talk a lot also about chronic disease management. The population is getting older, and there are chronic diseases that are out there that, if not well managed, can end up with a hospitalization. And so we actually try to avoid that. We try to avoid our patients coming to the hospital by managing their disease process proactively as best as we can.
Sure. And is that, I mean, it seems like it's a good thing to have the patient more involved in their own care, their family's care, things like that, and maybe trying to prevent some of these things by eating healthy and moving more and staying active, things like that.
Correct. And also taking the medications as they're prescribed on a regular basis, making sure you're getting your follow-up care. Absolutely, it is good, and good for the health of the community as a whole.
Right. And the hospital, it seems to me, San Juan Regional Medical Center specifically, has been very involved in doing preventative things or promoting preventative things, some of the walks, some of the activities and the equipment and things that have been installed in some of the parks to get people active and remind us that we need to stay active and things like that.
Absolutely. I think that San Juan Regional does a great job of doing that and definitely promotes things. In fact, the Walkathon for Cancer is coming up in the very near future, and we are sponsoring that.
Of course.
So, yeah, you bet. I think that all of those things are good. Designed, what we call design communities that are kind of designed around being active is something we'd be interested in the future as well.
Right.
So,
and when you're talking to the doctors and the folks that work in your field and managing them, I mean, they seem to be on board with this new trend, and I don't know if it's really new anymore. It's been there for 20 years, but this trend in healthcare of educating the patient and trying to make them more in charge of their outcomes.
I think that certainly. So physicians are on two sides of that, and both in the same direction.
Right.
What I mean is, yes, they want what's best for their patients, and that gives them the best patient outcome. But the other thing that is always looked at, and more so now than it has ever been before, is what are the individual physician outcomes. And those things are published by various bodies. They want good quality outcomes for their patients. Because it reflects on them as a provider, and they know that these types of activities will be good for them, whether that's orthopedics, getting people out and exercising post-operatively as quickly as possible, getting people up and moving, all the way to internal medicine, where you may be trying to manage blood pressure, diabetes, or heart disease. All of those things come with the preventive side of it.
My guest this morning, Dr. Bob Underwood, is here. He is the Chief Medical Officer at San Juan Regional Medical Center. We are talking about the world of medicine these days, and hospitalization and treatment and all those things. And you're dealing with the medical staff at the hospital, about 175 folks
or so, yes,
more or less.
Yep. And people come and go, physicians come and go all the time. So,
of course.
Yeah.
That's very true. But talking a little bit about that, it seems like, again, and you mentioned it too, trying to get folks up and out and moving again after a procedure, after surgery.
Sure.
Back in the old days, you might stay in the hospital for 7 days, and that's unheard of these days for most things. I mean, there's still some people that are very sick that need to be there, but a lot of times it's that nurse or that doctor wanting us to get up and just start moving to start that healing process.
Absolutely, and that is a change over the last several years. Is the sooner you can get somebody up and moving, the better it is for them, better for the surgery. Used to be that you came in and had a baby, you were there for days. It's kind of a next day discharge these days. Gallbladder surgery, 5-day admission, no longer the case.
No, right.
Some of them are even done on an outpatient basis now.
Wow.
It's very very interesting how we've seen the trends. And the thing is that it was perhaps just an urban legend that you needed that rest. What we found is the science proves that the sooner you're up and moving, the better it is for the patient.
Right.
So it's kind of an interesting shift overall.
Yeah. Well, and as homely as you try to make the hospital rooms appear, I guess being at home is certainly better for the patient in most cases.
Absolutely. The sooner you can get back into your normal environment, the better it is for the patient, generally speaking. Also, there's a lot of things that are happening at a hospital. It's not a place to rest. There's always activity going on. You're going to do better in your own home. Additionally, there's a lot of sick people in a hospital, and the sooner you can be in your normal, healthy environment, the better.
Right. And that's all part of these conversations and these decisions, I suppose, to get patients in and out, right?
Yeah, absolutely. That's part of it. We work really hard on, and these are things that we talked a little bit about the government, things that the government tracks. They look at how long do your patients stay in the hospital? What are their If they get readmitted within 30 days, usually that's a hit on the hospital.
I see.
And so we try to look at how do we keep patients once they're discharged, how do we make sure that they're home, healthy, and stable enough to stay home without having to be readmitted. We look at what we call hospital-acquired conditions, which include infections. There's different kinds of infections that we look at and we track very, very carefully. A number of other things that we keep on what we call our harm scale, patients who fall in the hospital, patients who end up with infections, patients who can have surgical complications. All of those things are tracked very, very carefully, way more than they ever used to be. Those things are reported through the government. The government keeps track of them. A good way to avoid all of those things happening to a patient in the hospital is to have them at home rather than in the hospital.
Right. And that's what we see.
Yes.
In most cases.
Absolutely.
I mean, for sure.
Yep.
Is cost part of that too? I mean, I'm sure it's cheaper for me to be sleeping at home than sleeping in your bed.
Absolutely.
At the hospital.
We are the most expensive hotel in this community. No, absolutely. And that's something that we look at. It's not just us either in terms of length of stay. That's how we term that, readmissions, et cetera. Absolutely. Trying to reduce the overall cost of healthcare. And again, it's not San Juan Regional necessarily. It is every hospital system in the country is being scrutinized for those very points that I just talked about.
And these statistics that you keep mentioning that are being reported to the government, these are available to the public, I would think, right? In certain reports or what have you. And as the public becomes more involved in their own health care, I mean, they are, I guess, encouraged or could be encouraged to review, compare, contrast different healthcare providers and hospitals and things like that?
Absolutely. So the CMS, which is the Centers for Medicare and Medicaid, they actually have public reported information that you can look at. One of them is called Hospital Compare, where there's a star rating. There's a lot of deliberation of the validity of the data that goes behind that, and the American Hospital Association debated it a lot. But the star rating is there, and it's publicly available. I have to say that when I came here, it's a 5-star rating scale.
Right.
When I came here, we had just moved from a 2 to a 3-star rating, and we are waiting for the final to come out. They were supposed to have reported, CMS was supposed to have reported a couple of months ago, but we've got unofficial word that we're moving from a 3 to a 4-star as a hospital within the community, and that's great for our community.
Very good. Well, and that's within 12 months, it sounds like, right?
Absolutely.
So that's quick work.
Now, yes and no. It's lagging data. It's the Centers
see.
for Medicare and Medicaid, and they have a 2-year period of time that they review. That 2-year period of time ended about a year ago.
I see.
And we are intending that will trend in the same direction. We'll move to a 5-star.
I think you should still take some credit, though.
I will take credit where I can.
Okay, fair enough. Dr. Bob Underwood is my guest this morning. We're going to take a short break, Dr. Underwood. When we come back, more with my guest in just a moment here on KSJE. KSJE is supported by Citizens Trust and Investment Corporation, providing a competent, innovative, and caring team of professionals to serve wealth management, trust administration, employee benefit plans, retirement planning, and estate settlement needs. Find out more about Citizens Trust and Investment Corporation at 505-599